Welcome back to the For Your Best Self podcast. I'm Dr. Rebecca Novo, and it's a pleasure to be joined by Max Poling, PA. You had a busy day in clinic today.
I did. It was a blast.
Yeah.
I got to do a handful of different things. We did some lasers, CO2s, little XLV, injectables, and we made a lot of people happy.
It sounds like a fun day.
It was. How was you? You were in surgery today, right?
Yeah, today's one of my OR days. I did a mommy makeover, which is one of my favorites on a wonderful patient. And it's also a treat to be here. You know, we both put in full days, but I'm also energized and excited to talk about something we're both passionate about.
You know it, especially
Renuva.
Yeah, one of my favorites.
Yeah, long overdue education on, we're calling it a natural option for revolumization. A lot of people still haven't heard about Renuva, and it's been an existing option for around 30 years.
Yeah.
Aesthetically?
Mm-hmm. So I think
Medically.
Aesthetically, it was like 2015, I think is when it made that big transition. But yeah, it's been in the market. It's a cool company. I think just as a touch point, you know, I think one of the neat parts about it is kind of the inception of it and how it came to be. But to even just touch point initially on what Renuva really is. Right. Renuva it's a unique product because it's really this extracellular matrix that is almost like a comparison to off-the-shelf fat grafting. Right. So, you know, as a plastic surgeon, you know fat grafting all too well. And we'll get to dive into that a little bit later. But, you know, it's a neat option when you're able to really revolumize. And if you're the person who says, hey, you know what, filler's not for me, or if other products like, Sculptra or Radius or other things like that, you're trying to go truly the most natural option when you're able to replace your own fat and replace like with like.
Absolutely.
That's a pretty beautiful thing. And that's one of the fun parts of Renuva. So I know that you've been using it for a long time too. Since I've come into the practice, you already had it on the shelf, which made that an easy thing to pick up.
Yeah, I've been injecting Renuva for about 9 years.
Mm-hmm.
And I know you've been doing it for almost that.
The entirety, yeah.
And Max is also a trainer for Renuva so that we can get other practitioners injecting safely and having good outcomes. I will have to say, of all the things that we do, I have not seen a complication from Renuva. So safety is one of our pillars. And one of the beautiful things about our practice is, like Max said, this is fills a little gap in aesthetics and anti-aging, and we're pretty picky when it comes to products.
Absolutely.
Right. So this is a FDA monitored product with a very long safety track record. And Max and I both have a lot of experience. And to get a little science nerdy, Max kind of dove into like how the product came to be. And we don't really call it a filler, right? Like when you're talking with patients, it's a structure or a scaffold. Yep. Right. You use those same descriptors.
It's something where, you think of filler to volumize a space or to lift based off what rheology of a product you're picking.
Yes.
If it's a lower G prime, you're picking them maybe for your lips, soft, subtle. Right. But you picked a more high G prime product. It's going to give you more lifting for the cheeks, jawline, things like that. Right. And then fillers are your in-between, Renuva is going to be the in-between. It's going to help fill those gaps within that space. There's certain areas where you absolutely want to use it, and certain areas you don't want to use it. Right. The neat part of this product, like one of the things I love about it, is it really regenerates your own tissues. So, it's not confined by common terminology of saying filler or a biostimulator. Right. This is an X factor because it's replacing your own fat. It's not just a biostimulator. I mean, it does have a stimulatory response in terms of what it does, but the regeneration of your own fat is pretty unreal. So just like a few touch points on what the product really is. Right. When you break it down, it's truly this scaffolding effect where the best analogy or the best way to describe it is the honeycomb. Yes. All right. I think it paints a really good picture. Yes. I mean, you and I know you love bees, I love honey. We're in a good place. The amount of honey I own in my house is insane. But what it really is when you break it down, if you think of this honeycomb matrix, there's these isolated little lobules within there. So if you take that honeycomb, you put fat molecules in there, And what they're able to do is take that fat molecule, strip it away, and keep the stromal matrix that holds the fat, and then the denaturative DNA. And one of the ways in which they do that is it's their proprietary methodology of a chemical wash within that space. So they don't actually radiate the tissue, which is so important, as you know, because a lot of the times when you radiate tissue, it's not incredibly viable at that point. So the injection of the product, it's really, in my opinion, like it allows me to be natural within the space that's injected, because it's going to grow also to the size of the fat pertaining to the area. So we utilize this a lot for facial revolumization. It does. Because imagine like a messenger cell where you can, recruit your own fat to the area, because really you don't really grow new fat. As we age, you get fat die-off, attrition. But then furthermore, when you look at most fat molecules, you're either going to increase or decrease in size. That's it, just like a muscle. You get a degree of hypertrophy within there. So growth of new fat it's 100% intentional, not by accident. And really the only two ways to really achieve that up until now have been Renuva and fat grafting. So it's a cool process. The product itself, typically you're going to see maximum duration of variable outcome in terms of what they're going to say on paper is about 7 to 10 years. And they do have actually really good clinical data to support that. Some of the trials that they've done, they're still doing post tests on those patients to see, hey, what degree of new fat growth has been had. And as well as from a degree of safety, like how has it been? And the nice part with that company is they have a really good long track record. A neat part of the company that I think is always kind of special, because I don't like new, as you know, and we don't like new, we don't like old, we like things that are tried and true, that we can trust, and there's a degree of safety, to your point. And with Renuva, it's the company MTF Biologics, they were started in 1987, which it's been around for a while. It's about the same time as Botox when it first came out. And it was started by a group of orthopedic surgeons because they needed to harvest patellar tendons to do a patellar tendon graft. And since then, it's grown to be the largest tissue donor in the entire United States, which that's a big deal. They're based out of Newark, New Jersey, and that's where their key facility is up there. And
you got to tour it, yeah?
It was pretty cool.
What were your takeaways from that?
How much work and how much passion and care and to the quality that they have. So, there's federal guidelines on how you can process tissue, but what they do and what they hold themselves to are far above that. They have an industry standard that no one can touch. So when you're questioning this product, and I know sometimes there's concerns of like, oh, what is it? Where did it come from? There's no company that takes greater care or greater pride in that. They actually have a sheet, like a cloth quilt in there that was made from families of people who've, families that have had family members that have donated really the gift of life to a lot of people. And they do so much more. It's not just an aesthetic company. It's actually a non-for-profit. So what they do from a Renuva standpoint is they found this as just a niche to say, hey, we want to give the greatest gift of life. And they had discarded tissue that they were like, this is just wrong. And there should never be discarded tissue when someone has donated their life. And that's how this really came to be with Renuva and the processing of it and the care of it. So I love that story because I think it shows, number one, good intention.
Integrity.
It does, absolutely. Incredibly valuable. And it gives me confidence in a company like that to know that they really take pride in what they do and the utmost confidence. To your point on the adverse events and the safety of it, there have been legitimately 0 reported adverse events with Renuva in the entirety of that.
It's incredible.
It is.
Yeah.
Shy of a bruise and or slight swelling post-injection, that's it, which...
Right, not product specific.
I mean, if you ever look at the MAUD data on anything else, that's not exactly the case.
Circling back to the kind of how it works, and you touched on the honeycomb structure, the scaffold. I think it's for patients to really understand when they're selecting this product, it is human donated tissue. However, it is completely DNA-free, decellularized. What it does have is the messengers, the proteins, the collagen, basically the signals that are going to tell your body to fill the honeycomb with honey, which is fat, which is what we want, the golden, the good stuff. And it's personally, I love injecting it, but it's also I'd say one of the top things I've invested in myself. Max did my injections in the common places where we age, and we can, touch on that. And the mid face is one of the best places for Renuva, because we said, we should cover this. Isn't for every place, right? But it is really great for where there's fat loss. Where do you mainly inject? Let's start with you.
So I think it's a product that you can utilize in a lot of places. Anywhere where there's native fat, you can inject. And it's not if you think of, just as a slight comparison, if you think of like filler, just as a juxtaposition, filler has an FDA indication for a specific area. So if I took Restylane Contour and, by FDA indication, I'm only bound by injecting that to the cheek and temple, versus Renuva, it's not bound by that because it is donor tissue. So it doesn't actually have limitations within that. It's just, medically, we're always going to inject it where native fat is. Right. Common areas that you wouldn't often, inject are really going to be tear troughs, lips, of course, sensitive structures. But my most common areas, I love it for the cheeks. I love it for the preauricular space. Temples actually do incredibly well. Marionettes. And one of my favorite things that I've really come to think that it's a really missing piece of the puzzle, because I haven't yet to find anything else that is going to replace it and make it look beautiful and natural and elegant, is the upper cutaneous lip. Because so often it's one of the more neglected areas where someone might maintain lip volume, but with time, that upper cutaneous lip, it really hollows out. And filler, in my opinion, you can use a very small amount right there, but over time it doesn't really dissolve at an equal and consistent rate. And due to how animational that space is, Renuva has just blown my mind on that space. Because you do lose that little bit of the subcutaneous fat, hollows out the upper lip. And if you are the person who does maintain lip volume, it can somewhat shelf from filler. And someone might come back multiple times. The amount of patients I've had say, hey, I feel like I need more filler. I'm like, no, you don't. You don't need more filler to the lips. You need supporting structure to the perioral area. And that is, in my opinion, it's really a niche area for that product that just thrives. Because I don't think there's many other things that do well. We can do a CO2 for retexturing. Right.
But for revolumization of the area,
there's not much.
I agree. I found same for a lot of liposuction contours or scar tissue. I've had people fly from Canada just like to specifically get this product for depressions or dimples.
Absolutely.
Post explants, any little divot or depression on the breast.
Like the lumpectomies, I think those are, it's focal, but it's Yeah, I think that's an amazing option for those.
And you're doing gluteal revolumization.
I am. So it's definitely a piece of the puzzle. I had a patient in last week, and we really did a combination therapy for her. She had a focal hip tip depression that was of decent size and significant asymmetry to what was there. And that was her initial concern coming in. And, we talked about options. She also, after talking, she's like, well, I don't want just that fixed. I also would like to see a little bit more volume and a little bit more projection. So really kind of, tapering that edge. And Renuva I used exclusively. I used about 9 cc's just for the hip tip to give her the greatest degree of volume to that space, just given the size. And then we also subsequently used Sculptra and Radius to give her a little bit more projection on the upper poles. And so I think putting your best player in for their best position, hence why, with facial revolumization with this as well, it might not always be your number one option.
Right.
Because volumetrically speaking, sometimes it's not the most applicable or, financially astute thing to pick. It's when you're utilizing it for big win areas, I love it. Like one of my favorite things to do is after a round of Sculptra, a series of Sculptra, and there's just like that focal area. And I was like, there's just this one area I want. And, functionally, Sculptra is going to provide increased collagen. It's going to increase the matrix of the skin. So it's going to really take your skin like your hand and turn it into almost like the forearm. But if you think about Renuva, I get to go a layer deep to that and also revolumize from a fat standpoint.
Yeah.
And I think to your point, one of the big reasons in, as a plastic surgeon, fat grafting is a wonderful option. And the retexturing of the skin from growth factors, like, I mean, that alone is almost the reason to do it.
Right.
So when we talk about growth factors, when we talk about retexturing the skin, would you mind touching on, indications of like fat grafting?
Absolutely. Yeah. So that's a tool I use frequently in the operating room for facial rejuvenation.
Mm-hmm.
I mean, if you have a little tummy fat, it's really easy to get 10, 20, 30, 40, 60 cc's of donation fat. So I'd say it's the most cost effective per volume.
Absolutely.
But that being said, to do it in of itself, it's nice to do in combination of other procedures. But just to go to the operating room exclusively to harvest fat, it can be done in the office. There's plenty of people that do a little liposuction in the office and fat grafting. I just personally prefer more sterility and to be set up for that. So it's not wrong. There are definitely practitioners that will safely do fat grafting in the office. But since we have Renuva and it's so consistent and good, that is my office solution. And then usually in the operating room, we'll do liposuction. So anytime you're fat grafting, you are adding that recovery site, right? Where on the counter, Renuva or not, you have the injection site, which might have a little soreness, potential bruising, but it's really minimal. That being said, with fat grafting, you have to have the fat.
You do.
Right? And it's usually the people that don't have it that want or need the revolumization. So you really have to have a good donor site, which is, a lot of patients say, can't you just, can't you just? Like, well, the best fat for longevity is, tummy or maybe medial thigh. So there are, better donor sites, and then you have to have it to then be able to transfer it. So you do add the recovery site, but that's one of the pros of Renuva. It's off the shelf. Sometimes I can't keep enough on the shelf for Max, but we're constantly ordering.
We've had a lot of orders lately.
But that's a testimony to the product and,
Agreed.
the void. And I think that is special about our practices. We have a lot of tools, and it's picking the right tool. So that's where Renuva comes in.
Absolutely.
But as far as, I'd say that's the one downside of fat grafting is like, do you have it? And then the, additional cost recovery to be in the operating room.
Yeah. So, I mean, global, I think the comparison of when you would choose Renuva versus what else is on the market, when we really look globally, I guess, I won't even say competition because it's in a league of its own, but, we're going to compare it to filler, we're going to compare it to sculpture, we're going to compare it to radius, fat grafting, and then you have Renuva as that X-layer. And I think that to touch on, when to use what is a good question, because as we've talked, right player, right position, right time, right everything. And Renuva globally, when we look at full facial revolumization, that's sometimes where it's not always the most applicable, mostly from a cost standpoint. It's not expensive, but it's not inexpensive either. It depends on the volume that's needed and the threshold. And the last thing we want to do is make a recommendation where, I can tell you, we're never going to make a recommendation of too much, but we also want to make a recommendation of enough to see a measurable. Yeah, exactly. Yeah. Just as you go to your primary care and they diagnose you with high cholesterol, they test your cholesterol, they put you on a medication, it's going to reduce that. That's their metric to grade that. And for us, it's all photos. So we want to have that tangible result to where when you look at those before and afters, we get excited. I love before and afters. My favorite. But I think as a comparison, I think global volumization, when you deal with like facial balancing, things like that, Renuva plays a role in that, but it might not be exclusive to that. And I think that's where certain areas it really shines. And again, things we want to be mindful of is patient selection. Because we do want to be mindful of who we're injecting. If you're living in a catabolic state, that's a person that might be a little bit more difficult to have a appreciable gain. There was a plastic surgeon up in New York City, and he treated someone who was a bikini model, like right before season started. And she came back for follow-up 2 months later, didn't see any appreciable gain, but that's because she was pre-season. She was very much getting ready for that, and she wasn't really allowing any fat to grow to the area. They followed her after the season ended, and about 2 months after, she came back and she goes, "This looks great."
Yeah.
Because
so it wasn't a lost cause. It was all the activity was there. It was just pretty much dormant, right?
Exactly.
It wasn't being fed. And I think that's a really good point. I mean, as clinicians, we're navigating that with you. We're not going to recommend this if you're on your GLP weight loss journey, right? Yeah. Like, we don't want to be caloric deficient. You really have to be neutral or gaining. Chino Bay, I think, recommended, a tablespoon of peanut butter organic, tablespoon of organic peanut butter per day, for anyone that you really, he said if you're a BMI under 18, which is underweight.
Yes.
But I thought that was a cute pearl.
I love it.
So, we're here to, like Max said, pick the right tool that makes sense for your metabolism, your life, and your goals.
And then I think it has a lot of, taglines that could make it very enticing. When you talk about a duration of 7 to 10 years, and you talk about, stimulation of growth factors to help retexture your skin. Right. You talk about it being natural and being your own fat to the area that's injected to. I mean, all of those things, it's like, check, check, check. Yeah, that sounds wonderful. Why wouldn't I want it? But if you're not the right patient, if it's not the right product for you, specific to your lifestyle and what you're going for goals, that's part of our job, is to say, hey, just because there's a good product doesn't mean it's always the right product. Right. And I think that's where, really diving in on that consultation and assessment, evaluating your lifestyle, evaluating your long-term goals, not just saying, hey, where are you at today, but where do you see yourself in 6 months? Does that mean you drop 5 pounds, 10 pounds? Right. Candidly, one of my times that I'm always slightly reserved about injecting Renuva is around the holidays, because you're actually going to increase, but typically, like, come December and January, you're trying to lose a lot of weight. So, like, again, I love before and afters. I want to I want to be excited for you. And so I'm always slightly reserved about any time I'm going to have follow-ups in that, That's February, clever. March time.
I've never thought of that New Year's resolution washout.
I know. So I'm always...
We got your back.
And I always tell them, like, look, you just got to... I want your state to be somewhat plateaued. I mean, if you know what a standard fluctuated weight for you is and this, and you're saying, hey, I can normally, like me, I'm not kidding, I can fluctuate 8 pounds easy, high, low, and that's pretty easy for me. But if I were to drop 20 pounds, I would expect to see a marginal improvement because of that. Because you still see improvement, absolutely, and it's not at fault to the product. It's not at fault to the person injecting it. It's just by nature of what it's doing. Because fat cells, when in the body, you're either going to increase or decrease in size. And if we're not allowing the fat to grow, and if you're chronically living in that catabolic state, then you're not giving it its chance to really thrive and see its full potential. Right. But you will down the line if you gain the weight.
I just wanted to touch on the cost. And, we do speak of Renuva as an elite product. It is a higher price point. But if you really scale the, per cc and the longevity, it is really very cost effective.
Absolutely.
It's more of kind of a long game investment. Yeah. And of course, we might make recommendations that is multiple cc's, but that doesn't mean everything has to be done at once. Like, we're very, we
tiered
like
approach.
To build. We're builders, and, just making sure that things are working the way we want them to, so we can always build a treatment plan over time. And I think I'm sure you get asked every day, because I'm asked almost every day, how long does this last? When does it wear off? And it's not like a on-off switch. No. I mean, we talked about the weight factors, and we do need to have some stability there, but it's not like you put it in and then it goes away, right? I always like to say aging continues.
It does.
Right? We can't stop aging, so we get a new baseline. Yep. And then we support in other ways, or repeat the treatment. So it doesn't wear off in a sense that you might think like Botox, right? It has a 3 to 4 month activity.
And I think that's a great point to, like, the incorporation of other products and how this, best supports, because, aging is still going to continue, and you're not just this one line track. And with Renuva, we might be very specific in where we're injecting it and, to get the best result pertaining to that area, but the peripheral tissue is always still going to age, and things are still going to happen, whether it be texture, whether it be volume, or whether it be laxity. So, there's multiple parts within that aging process where, it's a consideration. And that's where I think that in-depth consultation assessment to really dive in deep and say, hey, what's our diagnosis? And with any form of medicine, you have to have a clear diagnosis in order to pair the best treatment with it. So does that mean that Renuva is always the best option? I can tell you it's replacing like with like, so that's a great option, but it might not always be applicable to that. And that's where we might use other accessory products to kind of make sure everything blends. You never want to be the person that someone walks into a room and my best analogy, I want you to be the person that someone double takes at, not stares at.
Right.
And I think that that's something where Renuva can absolutely be incorporated into that, in providing that beautiful, natural, long-term result and replacing your own tissue that you've lost with time. But usually it's going to come with some other recommendations to make sure it all blends, because you don't want to just have improvement in one area and then things don't
cohesion. I think, for better or worse, injectables in general, even plastic surgery is just also it's just so out there. It's just, people aren't hiding. It's just very conversational. People are very open, which is good and bad, because it's not as simple as, inject this in here, right? Or this bothers me. It really is an art form in the consultation and treatment planning. And I think that's what, that's why I go to you and Dr. Salucha and our injectors. It's just
we're fortunate to have good people. through and through.
So we talked a little bit about how much, just numbers 1.5 cc's is 1,100. We do have a bigger volume that we carry, and that, again, that's sounds like twice what kind of a normal 1 cc of filler is, but you do have to think about the longevity of the product
and
as a
location
investment.
which you're injecting too. Right. So one of the cool parts is it's going to grow to the native size of the tissue that it's injected to. So if I were to inject this into someone's upper cutaneous lip, those adipocytes, the lipids, are far smaller compared to other fat particles to the face. Same thing that what we would typically expect about a 3-month result in terms of seeing injections of the face, just because fat's usually a little bit smaller there. If I'm treating body, oftentimes it's not uncommon that I'm going to see you back in 6 months to really see the full maturity of that fat cell really grow to maturity. You can absolutely see improvement by 3 months and even a month, 2, 3, and so forth. But that's why sometimes body, it takes a little bit longer to really see that appreciable gain given the size of what's injected. But it is an amazing product. I've treated some people, and one of my favorite things to do with it is acne scars, paired with a little subcision, but it's amazing with what you can do and revolumize that tissue after breaking up those tethered adhesions of scar tissue.
Support.
You get the benefit of the growth factors, again, for the retexturing of the skin.
Great indication.
And it just is a beautiful thing. And when I give talks for Renuva, it's one of the things that I talk a lot, that I think it's really an underutilized or underappreciated, not just for the aesthetic person of somebody's walking in to say, hey, I just want volume, but also for those acne patients, because it really, I think, it's unique in that, because you can customize it to do a lot of different things. So if somebody has like subtle rolling scars, I can really kind of titrate the properties of it to get more of a textural gain out of it as opposed to central volume. Or if somebody has that real big cystic acne that they've had intense scarring to, well, I'm probably going to keep that a little bit more true to size, get immediate volume correction out of that. And then I might take a second one and kind of blend and kind of retexture the peripheral area. So it is a tough product. Whenever I do trainings for people, it's a little tough because
nuances.
It is. Yeah. Experience comes with that, and also knowing there's a lot of ways to adjust this pertaining to what you're trying. So as you can appreciate in any medicine, I'll never forget going through schooling, and I had one of my professors. He was an ER physician, amazing guy. And he never got a straightforward answer out of him. It was always, it depends.
It does depend.
It does.
It does. Depends.
And I think that's one of the neat parts with Renuva and the application of it is, how do you utilize it? Well, it depends. It depends on what you present with. It depends on what you want. It depends on what our goals are. So, having that candid conversation and seeing what other opportunities exist and if that's the right option for you, I can tell you it's an amazing option. If it's the right option for you, it all depends.
Right. It depends. I think frame Renuva as a revolumizing option where we want to restore fat in small to medium volumes, good longevity, very safe track record, face, neck, breast, body, if there's imperfections.
And if I may touch on the body imperfections, one of the amazing things you can use with it is if somebody, when dealing with a very skilled and plastic surgeon like Dr. Novo, that's one thing. But sometimes there's a lot of people who are not as skilled. And I will say, I think you could probably touch on liposuction. And liposuction is a very finesse.
Oh,
oh my gosh.
Yeah, there's more negativity often that comes from liposuction because it's so widespread.
Yeah.
Yeah, I do it, but I use it very particularly.
And I think that's the right call because I think
it's not a weight loss.
No.
It's not a debulking.
Yeah. And I mean, I've seen so many patients in practice to have negative results. And this is not bad about liposuction. It's just the credentials of who you're going to, making sure that you have consistent results. But
it's almost inevitable.
It is. Inevitably, you do it.
Yeah.
And there can be a degree of what's called lipodystrophy, which is the irregularities that you notice of when you're removing fat, especially to the thighs is a big one. Abdomen, you can get away with a little bit more over there, but the thighs are a tough area. So for people, and unfortunately, I'm very thankful because in the state of Florida, obviously they've limited the amount of surgical BBLs that can be done. And now you can only do 2 per day, ultrasound guided for many reasons, amongst others. But there were a lot of cases that I've seen where, not exactly the best results from liposuction. And they have irregularities. I have one female, mid-30s, and they treated to the thighs, glutes, and she has like shark bites. And we've done 2 sessions of Renuva for her, and I can't tell you the results that we've gotten to help soften that contour and really regain a degree of confidence for her, because we live in Florida, and guess what? People like to wear bikinis.
Because the only other solution is fat grafting.
It is.
And to fat graft, you have to do what? More liposuction, and they're so traumatized. They don't want liposuction. You have to have those conversations. I love Renuva for that. I use it mainly since I do more surgical facial rejuvenation. You do more injectable. I feel like I do I use it most for little body imperfections.
And I think it really is a fun product to see, and the growth of that. It's pretty impressive.
Yeah. And we'll touch briefly, we won't take a deep dive into a pipeline product, which is same but different. Similar, I won't even say same. Similar but different than Renuva, which is aloe clay. And Max and I are both in touch with this product, paying attention. It doesn't have the track history of yet. It'll get there. So we're kind of observing this product on the pipeline for larger volumes. It is a true fat, like we say, we have the honeycomb with the growth factors. This is the honeycomb with the honey. There is a very, very low level of radiation to denature the DNA and just make sure that there's no basically viral or any potential contamination passing from donor to injectee. But so we're watching this, but it is exciting because I'd say the one Renuva is cost prohibitive here if you're wanting to do 10, 20, 30, 40. I'd say 20 and up. Not that we can't.
No.
But this is a little bit of a bulkier, more volume product.
Absolutely. I mean, I had one patient from California, she came out. I did telemedicine consult, and she was post BBL, and so she had already had liposuction. She already had the fat grafting from a Brazilian butt lift, and it was an interesting case. A lot of times people post BBL, I think you can even touch on that, where a lot of times there's only so much fat to take, as we mentioned, and you can usually either get a correction of the hip dip or the projection. Very seldom do you get both. And so where I was at previously, I just had a lot of patients that were post BBLs. We didn't render them in the office, but we were just further south. And Renuva was kind of my go-to on that, because they wanted a more long-term option. It just was expensive, and to your point. So I think Alaclay is I'm hopefully optimistic.
Yeah.
Let's put it that way.
I agree. I think we'll get there.
Absolutely. And I think the verdict is still out. We like being excited for new products, but we are always going to carry a degree of skepticism, not by nature of the product, but by nature of care of our patients, right. Because we want that consistency and safety, and really the whole package that comes with that. So I think we're very much, we'll see what the future holds on that.
Agree.
Yeah.
You'll be the first to know.
Yeah.
Is there anything else you want to add about Renuva? It is in the office. Let's walk through just briefly kind of what it means to be injected.
Yeah.
Cleansing, surgically cleansing the injection area with a surgical soap, a little bit of numbing, injected.
Actually, a port site.
Right.
Tiny about.
And then whether it's cannula or needle injection, it kind of depends on location, depth, and flow.
Absolutely.
But that really should just feel at most like a little pressure.
Yep.
Max used a cannula with me. It was painless, like very comfortable pressure at most.
Swelling's usually not too bad with it.
No.
Minimal at most. Again, reconstitution slightly dependent on that, but yeah, I think for the most part it's actually one of the more comfortable injections. Burns a little bit when you first inject it, but very subtle, because we add a little lidocaine to it as well, just for added comfort post-procedure, which is common practice with pretty much any injectable.
Right. And then no real post-regimen. I mean, you don't want to put a lot of direct pressure on the face. I do like little facial massage, a little microcirculation to the area. It's not like a prescribed regimen, but just kind of when you wash your face, when you do your skincare, kind of small little circles.
And you can go back to your normal lifestyle.
No downtime.
In like the very next day.
Right.
So if you want to go work out the next day, go work out the next day.
Right.
There's really, it doesn't interrupt your lifestyle,
right.
which is a beautiful part. And anytime where you can get some revolumization, retexturing, I mean, that's pretty nice to not have any downtime. So truly off-the-shelf fat grafting in that regard.
Yep. So if you want to learn more, you can schedule a consult with our office. We are at www.foryourbestself.com. If you want to learn more about Max, myself, or the other practitioners.
One thing, if I may. Sorry.
Always.
I didn't want to interrupt on this one, but I think this is important to do. So and if you're like, obviously, that website that Renuva has is a great resource. I think we are one of the top providers in at least all Central Florida for Renuva on that. I can tell you we're definitely between you and I, we have the most probably history in injecting it, experience injecting it. They don't provide that on there, but they do provide you with practitioners within that space, which I think is really valuable for some people.
Absolutely. You can always come visit us too if you're not in Florida or Melbourne.
And that's where I say experience.
Yeah. You can follow us on Instagram. We are Dr. Saluja_Dr. Novo. Comment, share, let us know what you want to hear more about, or just come in the office and see if Renuva is part of your treatment plan. Thanks for listening.
Thank you.
Thanks for being here, Max.
Thank you. Always a pleasure.